morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, good morning. Welcome back to Insurance Matchmaking. Had some things pop up this week that I thought, I kind of wanted to address and readdress, just things I've been noticing. People, they're going for the shiny object, as we like to say. Ooh, this looks really good. Why didn't you offer me this? And then I have to take the time to go back and say, okay, this is why I recommended this. And one of the examples was, this is a Medicare issue, was, everybody sees the food cards and say, oh, that's great, and this plan it's not a bad plan, and the food card's very generous, and it turns out, the individual, it's a chronic special needs plan. That's what most of the plans now that are going to offer those food cards are going to be the special needs plan. They're not just the general run-of-the-mill Medicare Advantage plans. So this individual, we had suggested a give-back plan. This company has a very generous give-back, which pays great portion of that Part B premium. But of course, when you get that give-back, you give up some of the other benefits. The dental's not real robust. The over-the-counter's okay. It's, actually, the over-the-counter's, I think, probably better on this one than on the other plan, now that I'm thinking about it. But the way it handles prescriptions, the give-back plan actually worked better for this individual than the one with the food card. Now, the food card can come in very handy. You take the card, you go to Walmart or CVS or what store that it's allowed in, and there's certain things you can buy with that card. They call it a food and home card. You could actually use it to pay for, like utility bills or partial of your utility bills, depending on what your balance is on the card. I think generally, though, that's one of the drawbacks. Also, there's a certain amount on the card, and so some of the utilities will say, "Yeah, you can use that card to pay it, but you have to pay it in full." Well, if you're just, for example, your bill's $150 and you only have $103 left on your card, they won't take it for the bill. So now you got to figure out where am I going to spend that money. So that was kind of what transpired with this individual. The other thing was, this individual had several prescriptions, and the plan that had the food card had the deductible on all tiers of the prescriptions. So he would be facing paying 100% of his prescription costs because he hadn't met the deductible yet. And I'm going to get into some things kind of addressing deductibles a little bit more in this show also. So what ended up here was, he was going to be looking at paying, $100. I can't remember the exact amount, but it was over $100 a month on his prescriptions because he hadn't met the deductible. And I'm talking about these weren't brand names; these were the generics, tier 1, tier 2. Very inexpensive generics. And again, I say very inexpensive. Even with this list of them, he was looking at like $100 out of pocket because he was paying full price for them. Versus on the other plan, tiers 1 through, actually, I think it was just tiers 1 and 2, weren't subject to the deductible. So he was looking at spending $15 a month for his prescriptions. And also the one with the food card had a premium on it, around $27. So you add all the different costs together. The only thing he really was going to gain on the plan that had the food card was it had more robust dental than the other plan. And if that's important, that's important. But I find that, because I'll get the phone calls, hey, somebody called me, said I should look into this food card, or I got something in the mail about a food card. And most of the time, the people that are calling me, they actually don't qualify for the plan that has the food card. And sometimes it's just they live in the wrong county. The plans that have the food card, there are none of them in their county. Or it's that the chronic special needs plan that offers the food card, and you have to have, heart failure, kidney failure, or diabetes. And if you don't have any of those conditions, you can't sign up for that plan and you can't get the food card. So I think what I'm trying to get at is, and again, goes back to that value of working with a local agent, not calling the 800 number, not not giving the people who call you randomly the time of the day, give your time. And I know it happens. I mean, I get robocalls all the time. Fortunately, I think, again, I've mentioned this before, the phone system we have, because it does like a greeting, it rings and gives you a greeting while it's ringing on our phones to answer. It takes that as a voicemail, and a lot of those robocalls will disconnect, or they'll think they're talking to somebody, and again, it's AI. So you got AI talking to AI, and we don't take time out of our day to answer that phone call. We're working with the people that we're helping. So, and I got a little off topic there, but the main thing I wanted to cover on that is, and again, it doesn't have to be me. Hopefully you would come to me for your help. And if I have helped you and I have enrolled you in a plan, hopefully you will come back to me when you have these questions. And that I kind of hit on this on last week's show. And when you have those questions, let us know what that question is when you call. If nobody answers the phone and you have to, and it asks you to leave a voicemail, please do and ask us what the question is. I used to do this when I was teaching. The kids would come up and they'd say, "Mr. Libby, can I ask you a question?" And I'd look at them and say, "You just did." And they'd give me the funniest look. I'm just one of those, if you're going to ask me permission to ask a question, let's save each other some time and ask the question. Because it doesn't change how I'm going to answer it that you ask for permission first. I don't know. And I don't know, some people that maybe that's the way they're teaching you. It's like, hey, you don't just come up to somebody and start talking to them. You ask them if you can talk. If you're asking me, you can ask a question. You just did. But in our case, a lot of times, and the reason I say, Amy can answer a lot of the questions. She's as longer as she's in the office, more things she picks up from, hearing the answers that I give people, or she'll ask me the answer and then ask me the question and go back and call the person. So, and some of that is, and I don't mean this to sound rude, but sometimes I don't have the time to take your phone call. Amy can come and ask me the question. I ask the question. She goes back to the phone to give you the answer. And I go back to prepping for that appointment that's about to come in 5-10 minutes. But if you get me on the phone, we start visiting. And I'm not blaming, it's not just me. It's not just you. It's me. We'll start gabbing. And in that 10-15 minutes that I was planning on spending getting ready for that appointment that's coming up, whether I have to call them or they're coming in, I was visiting with you. So if you have a question, lead with that. Lead with, hey, I got this thing in the mail about a food card. Why, does that come with my plan? Again, that's a question that, Amy, in the time being, will need to refer to me. But if you leave that in a voicemail, we can always, text you back the answer. Or we have the answer when we call you back instead of now, you call, hey, I got a question. And then 2 hours later, I've got time to call you, and you're not there. As I leave a voicemail, say, hey, I got your commit, and we play phone tag. And then you get a hold of me at the end of the day, and it is something I do need to research with the carrier. I can't do that till the next day now. And again, a lot of those things I can pass on to Amy to do. And I know I got a little off subject here, but when you have the questions, call us. Don't call, absolutely don't call the 800 number. Sometimes you can call the carrier, and a lot of people don't know. You have your health card. If you have your card from your plan, there's a phone number on the back. And that phone number is your customer service or member support or whatever that, they want to call it. But that's the number you can call. And sometimes that is the better route. Not that I'm trying to pawn you off, but sometimes we can't get the answer for your question because we're not you. So you can always reach out to us first if we can't get the answer. But sometimes, and one of the biggies on that is somebody wants to change how they're paying for their plan. I can't change that. I can help you set up the method of payment for the plan when we sign you, when we enroll you a plan. I can put in your banking information. But I've even had it go so far as if I've transposed a number, and then I call in and say, oh, this is the right number. They won't let me do it because I'm changing the payment method. So that's why we try to be very accurate when we put your bank account information in, because if it's wrong, I'm not the one that can change it at that point. You have to do it. And that's not with every carrier, but it is with most. So if you need to change your payment method, that you just contact customer service. Or if you're savvy enough to sign online and sign into your member portal, those are changes you can usually do yourself online. It's not that we don't want to help. It's just one of those things we're not allowed, generally aren't allowed to do. But so one of the things that comes up a lot is, I got this plan and it sucks. It doesn't cover anything. And the thing is, it does. Most plans, and especially if it's a marketplace plan, it covers everything. Where the confusion lies there a lot of times is how that deductible works. And that's something I probably get a little more detail in that after the break, the commercial break, because I want to go into it. But so that's one of the things I've got. Like I said, this week had a lot of people that they're seeing this, the next shiny object, and they're like, well, why didn't I get this plan? We have a reason we put you, we suggest a plan, and we give you the reason for that, and so that helps. And I know there was some not misgivings. What's the word I'm going for? That I understand why we didn't compare the plan this person, because they went online and we're looking and saying, why didn't you get me this plan with the company? You got me this plan. One of the things that irritates me when it comes to the Medicare Advantage plans, when we're using our quoting platforms, most of them won't let us look at what's classified as a special needs plan at the same time as looking at just a traditional Medicare Advantage plan. In fact, we can't compare the Medicare Advantage plan that doesn't have drug coverage to the ones that do. It's like you have to do those in separate, and that's just an irritation. And so that's one of the reasons I realized, we kind of missed was, hey, we still need to kind of look, see if one of these plans might have been a good fit. And then the other thing is, the plan and the carrier that we were working with, they're not here in Putnam County. We were working with somebody in another county, and so it was one of those plans we don't look at a lot because it's not available here. So there was a couple of things there that kind of prompted it. Oh, we missed considering that plan. We had an idea of what was going to be a good fit for this person, and didn't look at there is some other potential options. So that's something we need to keep a better eye on. So we're getting close to the break time here. Like I said, I'm going to get into this, deductibles and some other scenarios of how to make a plan, your health plan, your health coverage. I'm going to say your health plan, your health coverage, because we're going to talk about more than one plan. And just kind of remember, and one of the things I realized came up this week is that maybe people don't know where we're at. I've noticed one of the things when I was doing some searching on ChatGPT is they still, have been using the wrong address because they'll prompt me like a script, and then they'll say, come to our office, and then it's like, oh, they have my old Willow Avenue address. We're now on South Jefferson. And great news there, the paving. Actually, by the time you're listening to this episode, because I actually have one ahead, so this is going to be a couple weeks before this actually airs, we may have our street paved. They came by yesterday and did some paving in the parking lot and said they're going to be doing paving the lanes at night. This is the 1st of July as I'm recording this, so I'm guessing that probably won't happen until after the 4th of July weekend. I'm not expecting them to do it the next day or two, but next Monday, I think they may start doing it. And then when I say Monday, they may start on Sunday night, because that'll be the Monday shift. So anyway, we're at the commercial break, and we'll be right back.
Your home is more than four walls. It's where your family feels safe. Twin Lakes Security helps keep it that way. Discover the most popular home security products: smart home panels with face recognition and live camera feeds, smart smoke detectors, indoor and outdoor cameras, and a video doorbell so you always know who's there. Watch live, get instant alerts, even unlock the door from your phone. It's all backed by a friendly support team based right here in the Upper Cumberland. For a free quote, call 931-528-2005 or visit twinlakes.net. Twin Lakes, security made simple. TN certain receipt-0026.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back on Insurance Matchmaking. So one of the things I did was, and I've been doing, I've had a show a couple weeks ago, I guess now. We have that new plan out called the Medical Expense Shield, where it combines a high deductible short-term plan with a fixed benefit plan that pays for the health care as you go. So one of the things I kind of wanted to get into, because a lot of people, when I talk about deductible, and I talk about max out of pocket, and especially when they're sitting in my office, they get the proverbial deer in the headlight looks when I start using these terms. And I know I use them every day, so I know what I'm talking about, and it just comes, natural, and just think everybody. But just kind of go back, the quick, easy answer, deductible. And what it is the plan isn't paying yet. So it's not that the plan doesn't cover it, it's just not paying for it yet because you have to pay your share first. So that's the whole thing about it. The deductible isn't about what's covered, it's about who pays first. Everything on your list of covered services is covered from day one, but you may have to pay the first $1,000, $1,500, $5,000, $7,500. You may have to pay that first. So that's the first part of the cost. You're the one writing the check, not the insurance company. But once you hit that deductible, and then you may have some cost sharing comes with that, also called coinsurance. And so say you've met the deductible, now the insurance will start paying a share. And that's where you've seen plans that are 70-30, 80-20, 50-50. So you're paying, after that deductible, you have a cost sharing amount. And you're paying, say, I've just used the 50% example. So the example, and the reason I'm bringing that up is because one of the plans we were looking at yesterday, the bronze plans, so the marketplace, we've got the ones called the expanded bronze, and why they call them expanded is they do have like copays for doctor visits and prescriptions and urgent care, and then everything else is subject to the deductible. So the good news there is generally when you go to the doctor, it's covered. If you're going in for your wellness exam, a well baby checkup, or women generally are doing things like their mammograms and they're seeing their OBGYN. If it's that preventive visit, now if you have marketplace insurance or employer insurance, you're not going to pay a copay for that visit. It's going to be covered. But if you go in with a problem, you're having some pains, you're feeling like something unusual is going on, so you go see the doctor. Well, now that's a doctor visit, and that's going to be subject to copays, or in some cases, subject to the deductible. There are plans that have no copays. You just pay the deductible, and you're paying for everything other than preventive until you meet that deductible. And then generally, most plans are going to have coinsurance after you have that deductible, and so you're paying a portion of the cost until you hit the maximum out of pocket, sometimes abbreviated as MOOP, M-O-O-P, rhymes with poop. But the good news is if you do hit that number, the bad news is you've had a bad year if you hit that number. The good news is if you hit that number, you're not paying for your health care the rest of the year. Your insurance company is. So that's kind of the difference. A lot of plans, they'll talk about the deductible, and they're really talking about the maximum out of pocket. And that's why I always try to, bring up on here to kind of differentiate those two, because there is confusion on it. And I get the confusion because people look at deductibles like that's what I pay before the insurance pays. Kind of like, when you have you use the example of, need body work done on your car because of an accident, and maybe you have a $2,000 deductible, and and it's going to cost $10,000 to repair and repaint and all that, you're going to pay you get the bill, you pay $2,000, and they send, and then the rest goes to the insurance company. Health insurance is not that much different, other than the fact of you pay the deductible and then you're paying a portion of the cost until that maximum out of pocket. The maximum out of I guess there probably is theoretically a maximum out of pocket on any home or auto plan, but most people are not going to hit that. But there are limits. If you need to get a new roof, well, did you have replacement costs or actual costs, or is it a percentage of after a certain amount based on the age of the roof, it may not be covered 100% to get a new roof. So there are some limitations on those. And again, that's not my specialty. I just wanted to say you generally don't have a deductible and then a cost sharing with like a auto plan. Most health insurance plans are going to have that. So that's kind of how that works. Came up with a little chart. When I say I came up with a chart, Chat came up with a chart because, and it's going to just kind of help me talk about it, but I may post this as an image on my Facebook or something too, because this one's the only part. That last part, the who it fits best. I'm not really agreeing with. Chat came up with it, so I may modify it, but. You have low deductible plans, and you have high deductible plans. And what we do in our office, and I know I'm not the only agent doing this, is, and even on a low deductible plan, we still recommend. If you've heard me talk about we started addressing the umbrella plans, that we don't ever recommend a Medicare plan without umbrella coverage. Well, the same applies to our under 65 plans. We still want you to have umbrella coverage. Because there's going to be catastrophic expenses that could come up, and they're going to hit you even if you have a very high coverage, very robust benefits, low deductible. But you're going to have a higher monthly premium if you have a low deductible plan. They work inversely. The lower the deductible, the higher the premium. So you're paying for coverage, and the thing on that is. You may be paying for coverage that you're not using, because if you're healthy, hardly ever going to the doctor, even with a low deductible, you're probably not going to even hit the deductible. You're just doing, say, your copays and you go to the doctor. And that's one of the reasons why we'll recommend looking, very much considering a higher, and I say high deductible or higher deductible plan, because it's going to be a lower monthly cost. Now, you're going to have that higher deductible. You're going to have more out-of-pocket costs up front, and so you're covering more before your health insurance plan is covering. So we talk about the gaps in insurance, and one of those big gaps is always been the deductible. What's the cost sharing? Your cost sharing is a gap, whether it's a co-insurance or a co-pay or a deductible, anything that you're having to pay instead of the insurance is a gap in your coverage, but it doesn't mean that's a bad thing. It's just because, again, that gap in your coverage, the bigger the gap in your coverage, generally, the lower your monthly cost. So again, I always like when I compare a Medicare supplement to a Medicare Advantage. Medicare supplement has a higher monthly premium. I say you're paying for coverage. When you get a Medicare Advantage, it's pay as you go. So you can have a lower premium, but you're going to have more out-of-pocket costs. So the thing is, you get something with a low deductible, and you're paying a higher premium, and I say you go to the doctor once or twice, let's say once for a checkup, which is going to be covered 100%, and then you only have one or two times that you get a sore throat or your allergies are really acting up and you need help from the doctor. Maybe you get some prescription medicine for those allergies instead of just going to the drugstore and getting over-the-counter stuff. You're going to pay for that doctor visit. So. But if that's all you're doing every year and you have a low deductible, you're not meeting it. You're paying a higher premium to save, $1,500 or $2,000 on your deductible. And that's one of the things, especially with the marketplace plans right now. If you look at you got bronze, silver, and gold. Gold is going to have a much lower deductible than the other two levels. Even, the silver's, you're not really lowering your deductible much on the silver. The thing that gets me is the maximum out of pocket is not that much different. The max out of pocket from a bronze is like, I think it was like $1,100 when the plans we were looking at yesterday. And then the gold plan, it's $1,800 difference in the maximum. Now, that deductible can come in really handy because, like, if you take a trip to the emergency room and you have a gold plan, yeah, you probably will meet the deductible on that trip. Or you spend one night in the hospital, you probably hit the deductible. But you're still maybe not going to hit the maximum out of pocket unless something catastrophic happens where you have to have a surgery or you had a heart attack. Like I said, something catastrophic. You're going to hit the maximum out of pocket. But the thing is, you've been paying a huge premium on that silver or gold plan compared to what you would pay on the bronze plan. And that's why we always try to supplement that. We supplement it, and there's a couple of ways we do it. One is the fixed benefit plan, and that's what I like about that medical expense shield that just came out. I mean, it just started in June. I've only been able to offer that plan for a month right now. It takes, and what they did, they've always had a fixed benefit plan. I think this one's a little better. It's comparable to a plan that I had been selling to people as a standalone to cover, or say, hey, get this really high deductible health plan, and then let's get this fixed benefit plan that will pay for your health care, and you're not going to worry about the deductible unless something catastrophic happens, and like I said, like a heart attack or being diagnosed with cancer. And the reason I bring that up is you can get a plan that will pay you $20,000 to $30,000, for a developing cancer, having a heart attack or stroke, for much less than buying that lower deductible. And that's what I usually tell people a lot of times. It's like, well, what you're doing when you get this plan is you're buying down your deductible. So that's the way that works. Now, that medical expense shield, it's basically two plans in one. It's a short-term health plan with a $25,000 or $35,000 deductible, but then you have a plan that's going to pay for your health care along the way. It's going to pay so much for a doctor visit. It's going to pay so much for a surgery, for a night in the hospital, for an ambulance ride. It may not cover it all, and again, whatever you're paying for it is going towards your deductible, but you're getting help pay for it along the way. And if you don't have any of those problems, you're not paying, the deductible doesn't matter at that point. You're getting help paying for your health care, your x-rays, everything during the year, and prescriptions even. So you could have that higher ceiling, but it's offset by that supplemental plan. That maximum out of pocket is going to be higher because of that high deductible. A low deductible plan is going to fit someone who has frequent and predictable medical needs. But like I said, if you're generally healthy and not worrying about having not worried about having a bunch of health care costs, a low deductible plan, you're paying for that deductible, and you're not getting any benefit out of it. You can put that, and that's the thing, that the savings between your premiums, you don't have to put the whole savings on supplemental coverage. You can, but hey, now maybe you throw in some life insurance too, because you've got a little bit more money to spend on your health care and your personal needs. So that's something we can look at. Love to have you come by the office. As I mentioned, maybe by the time you're listening to this, the paving may be done on South Jefferson. We're at 1683 South Jefferson. We're in Suite D. They're in the same shopping center where the Domino's is, so we're pretty easy to find if you're, like I said, South Jefferson, and it's south of the interstate. South Jefferson runs all the way from the square all the way down to 111. We're in that section. So if you go to Sam's or the movie theater, just keep going and head towards Sparta, and you'll find us. So hopefully that'll help. Don't forget to go to insurancematchmaking.com and put your questions for the show. Check out the past shows. They're all linked right there to YouTube. And we do ask, they always say, if you watch YouTube, they always say, hit subscribe and smash that like button, or smash that, ring that bell that you be notified when the new episodes are posted. That helps us get the word out. We don't do it, we don't put a video out every day, so you're not going to get pounded with alerts, but we really ask if you can help us, subscribe, like, share, comment, all those good things. That helps people find us. And if you found this useful, we would appreciate it if you share with others. And keep listening to Grace 107.7, and we'll talk to you next week on Insurance Matchmaking.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.